Welcome to another episode of Med Madness, your go-to podcast for mastering USMLE topics. Today we are diving into a crucial aspect of patient care that every medical student and practitioner must understand: end-of-life care and the associated ethical considerations. Understanding end-of-life care is vital for several reasons. First, it ensures that we honour the wishes of our patients, providing them with the dignity and comfort they deserve in their final days. Second, it helps us support families through one of the most challenging experiences they will face. Lastly, navigating these conversations and decisions with sensitivity and competence is a hallmark of a compassionate and skilled physician. In this podcast, we will cover home hospice care, when and why it is recommended, and how to address family concerns, voluntarily stopping of eating and drinking, VSED, understanding patient autonomy, ethical implications, and practical considerations. A brief real-life case study to illustrate these points in practice. Let's begin. Next, let's discuss home hospice care. When a patient with advanced cancer and limited life expectancy decides to forego anti-neoplastic therapy, the primary goal shifts to optimizing comfort. Home hospice care is often recommended in such scenarios, especially when the patient prefers to remain at home and has a family member available to assist with basic needs. While most patients in home hospice care pass away at home, this can sometimes be perceived as a burden by the family, or some family members may feel uncomfortable with the idea of a loved one dying at home. In these situations, arrangements can be made for the patient to be transferred to an inpatient hospice facility when death becomes imminent. This can help alleviate the family's concerns while still prioritizing the patient's comfort. Spiritual support is a significant component of hospice care, offering solace to both patients and their families. However, it is important to address the family's concerns about the patient dying at home directly and proactively. Additionally, even if the patient does not currently have significant symptoms requiring palliative therapy, the progression of cancer will inevitably lead to worsening symptoms. Thus, a hospice referral should be placed as soon as possible to anticipate and address these needs. Next, let's move on to voluntarily stopping of eating and drinking, or VSED. This is a decision by some patients with terminal illness to cease all food and fluid intake as a way to symbolize readiness for death and maintain autonomy over the dying process. When a patient requests VSED, physicians must confirm that the patient is cognitively intact and making a voluntary decision. They should counsel the patient and their family about the possible consequences, such as severe thirst and discomfort. Alternatives to VSED, such as continuing fluids only or decreasing oral intake, should be discussed. It is also important to record the patient's preferences for managing discomfort, including small sips of fluids, oral swabbing, or ice chips, as delirium and cognitive impairment may occur due to severe thirst. Ethical considerations include respecting the patient's autonomy. An ethics consultation is generally unnecessary if the patient is competent and has a poor prognosis. VSED, while likely to hasten death, falls within the scope of patient autonomy, similar to do not resuscitate orders. Physicians must balance the principle of beneficence, which aims to relieve suffering, with the respect for a competent patient's informed decision to choose VSED. Intravenous fluids are not typically recommended in these cases, as they do not improve comfort or reduce delirium. Now let's consider a real-life case study. Mr. Smith, a 68-year-old man with advanced pancreatic cancer, has chosen to forego further chemotherapy to focus on comfort. He wishes to remain at home with his daughter, who can provide basic assistance. However, his daughter feels overwhelmed by the thought of him passing away at home. In this case, Mr. Smith's healthcare team arranged for hospice care to be provided at home, with the option for Mr. Smith to be transferred to an inpatient hospice facility when death became imminent. This plan reassured his daughter and allowed Mr. Smith to remain at home as long as possible, aligning with his wishes. As Mr. Smith's condition worsened, he decided to stop eating and drinking, feeling it was his way of embracing his end-of-life journey. His physician confirmed that Mr. Smith was mentally sound and voluntarily choosing this path. The physician discussed the potential discomforts and how to manage them, recording Mr. Smith's preferences for comfort measures. This approach allowed Mr. Smith to maintain control and dignity during his final days. In this podcast, we have explored the critical aspects of end-of-life care and ethics, focusing on home hospice care and voluntarily stopping of eating and drinking. Key takeaways include understanding the importance of respecting patient autonomy, addressing family concerns, and preparing for inevitable symptom progression in terminal illness. I encourage you to engage with the pre- and post-podcast quizzes and Anki flashcards to reinforce your understanding and ensure effective study. These tools will help you master the material and apply it confidently in your future practice. Thank you for joining us on Med Madness. Until next time, keep learning and stay compassionate.